Hi, Dr. Allison Feldt, pelvic floor physical therapist. Come with me to see how I treat someone that has SI joint pain and dysfunction, meaning that they have one-sided low back pain. Come see what we do in the treatment room to dissolve this pain, make it go away once and for all. We are going over some SI joint pain. This is one-sided low back pain. So let me have you turn your back towards me and point exactly where you're feeling this pain. Let me have you bend forward and touch the ground. And come back up. Any discomfort with that?
Just a big stretch down the hamstrings.
Okay. And bend backwards for me. Let your arms come down and reach down to the right side. Any pinching or stretching there?
Nothing there.
Good. Go down that side. Anything there?
A little pull through this hip.
Okay. Come back up. And then I'm going to have you backward bend and then come. Any discomfort with that?
A little pinchy.
Okay. And then let's do the same thing over here. I'm going to move your hips around and just see what's happening here. Perfect. Great. So I'm just going to feel through the borders of the sacrum. And ideally, to help unload that right-sided SI discomfort, we want to balance all the muscles that are attaching to the pelvis. I'm going to have you go up into a cobra just so I can feel what's happening here. Is that pinching on the right?
A little bit.
Okay, come back down. Relax your butt, and then I want you to come up again. I'm going to try and hold that there and see if that reduces the pinch. Is the pinch gone?
Mm-hmm.
Come back down. Okay, go up again.
Yeah, that's better.
Okay. So say she ignores this and doesn't address this, it most likely will turn into a sciatic pain running down her leg when the nerve root gets irritated enough. Right now, we want to take pressure off that nerve root by helping reduce all the pulls on the spine and balance the muscles on the pelvis. Cobra one more time. Relax the butt, relax your butt. Let the vertebrae glide. Let's go into it again. Relax the butt. So you can tell her glutes are really guarding for her. Okay, come back. Come up one more time. Let the butt cheeks relax. Let them relax. When the glutes are firing, they're going to pull the spine backwards, creating this moment that doesn't allow the spine, the vertebrae, to glide forward like they need to when she backwards bends. Go back down. Let's go one segment lower. Go up. Come back down. Try and keep the glutes relaxed. Do one more with no hands on your body. See if we can keep it freed up. The glutes are starting to fire. Okay, come back down. So what would prevent the pinch completely is if I had her prop this leg out and kind of, I don't know, bring this up to the side. There you go. And now cobra, but keep your butt cheeks relaxed. Is that pinch completely gone?
Pretty much.
So we all have old patterns that can drive SI dysfunction or SI joint pain, and pregnancy and postpartum amplify any dysfunction that we already had. Katrina had previous scoliosis, which has amplified her dysfunction a little bit. And then she is a little over 14 months postpartum, round 2. And so her pelvis is still healing. And we're trying to improve her hip extension, her glute activation. But if she's pinching when she's getting any lumbar extension, it's hard for her to work and build her glutes up. That pain that you feel in your SI joint, that's going to shut down the glutes. And then things start to compensate. You just saw me get around her SI joint. I released her rotators on this side that are pulling on the sacrum. And now we released all the muscles on this side, especially the glute medius that was causing some of that pinch on her right SI joint. So now we need to work our way to the front. We're going to go into the hip flexors. Then we're going to check out her adductors, so her inner thigh muscles that are also pulling on the pelvis itself, creating some of that SI joint pinching. And then we'll slide into the pelvic floor intravaginally, and we will go up towards these muscles on the inside of her SI joint and see what's pulling on that joint. We'll release it, and then we will start to balance it again. So I'm releasing her psoas right here. Then I'll release her iliacus. A lot of people talk about those hip hooks and using a hip hook to release the psoas. It's not my most favorite release. Your ureter lays right on top of the psoas. And so you just want to, when you start to release the psoas, you want to release it gently. And so you're not jamming on the ureter itself. A lot of people have, enough adipose tissue above that they're not truly putting too much force on the ureter, but it's just something you want to keep in mind. The ureters are the mechanisms that leave the kidneys to carry the urine down to the bladder. Then I can feel some of her colon. Take a deep breath in. Then I'm going to drop over to the iliacus muscle. So now we're going to go into the internal evaluation of these muscles to see what we can release. There are 3 layers to the pelvic floor. The first layer, the second layer, and the third layer being the deepest layer. I will start on her right side of her body, and I'll start by exploring the different muscles and pulls in that first layer. There might be some scar tissue from the previous birth, and then we will navigate all the way up to the third layer and going up towards that SI joint just to see what's pulling where. It's really important that we work on both sides so we can balance these muscles so one's not pulling more than the other. Inserting. So now I'm just feeling some scar tissue. I'm right at the perineal body in layer 1. There's a couple muscles here. We have a bulbocavernosus muscle and an ischiocavernosus muscle. These all lead up to form the clitoris at the very top, but right now we're working at just the bottom of the vaginal opening. She has some significant density. This is more so, I believe, probably was there before her second birth. And so we're just moving this tissue around. We're trying to dissolve some of the scar tissue. And actually her scar tissue is in pretty good shape, but there is just some density to the first layer. So when there's density, the quality of the muscle isn't as healthy. There isn't as much blood flow to this area. So that means that her expansion of the muscle, so her ability to elongate the muscle, isn't as good as it could be, which then in turn means her shock absorption at the bottom of her core, which is what the pelvic floor does, isn't as great. So I close my eyes so I can really feel this scar tissue, and I can start to dissolve it and work it out. And she's breathing and working on opening the pelvic floor. She has so much tension through the backside of her pelvic floor that any pull on the backside is going to be stressing her SI joint. So there's significant pull here. Her first and second layer are glued together, so there's no way to differentiate between those two for her at this time. That's something that we can work on though. Her puborectalis muscle, this muscle slings right around the anus. This muscle has to be able to open and relax for us to have a good bowel movement or for us to pass gas. If there's a lot of tension in this muscle, it's hard to get the stool fully out to completely empty. It also can create some more tailbone pain or just low back pain or SI joint pain when this is really tight because of how it's pulling on the sacrum and the spine. So after this, we're going to check her cobra and see if that recreates that pinch in the spine, or this is releasing this has helped, and everything else we released has helped reduce that pinch, allowing the pressure to be taken off the SI joint. Chronic SI joint pain or pinching in that SI joint creates inflammation in that joint. Getting a cortisone shot or taking prednisone is just decreasing the inflammation. It's not healing the pattern that has caused the inflammation in the first place. So it's really important that we fix these patterns. Let's let this leg come a little bit straighter. Thanks. You okay with that? Mm-hmm. I'm going to back off here. Okay. I'm going to exit, take a deep breath in, and I'll exit on my exhale. So I'm going up to her third layer and just going to work on truly balancing that layer here because she has so much pull around the sacrum. There's a lot more density in the tissue on this left side of her body. versus the right. Okay, we just finished the pelvic floor treatment, releasing some of the borders of our sacrum, and now I'm going to have you lift up. There you go. Keep them let go. Let them go. Let them go. Okay, come back down. I'm going to just gap it right here. Go up one more time. Is that better?
Yep.
Okay. Okay, go up again. So see how easy you can keep your glutes relaxed when this isn't pinching? You can immediately tell it's not pinching because you're not. Okay, go up again. One more time. Let's just reinforce it. Relax it. Good. Come back down. You okay? Okay, now see if it holds at all. Try and keep that relaxed. Did that hold? Yeah. Thanks for joining me. I hope you find this information helpful. Like and subscribe to this video for more content just like this.